Over 25 years as a clinical nutritionist, my name is Dr. Zoue Lloyd-Wright, and I have seen many clinical deficiencies, but the main one that comes into my practice is iron deficiency, especially in pregnant women. I do address this always with a diet, but often this is not enough, especially in the third trimester of pregnancy, where you require a lot more iron. Unfortunately, a lot of women are put off by iron supplements because they've had bad experiences in the past, or they have a lot of unsatisfactory side effects, and especially when you're pregnant, it's the last thing you want. But I use nano iron, and I have found absolutely no side effects at all in any of my pregnant ladies. As a matter of fact, they talk about how they have more energy, they feel better, with no side effects because it's 100% elemental and 100% bioavailable. I really urge you to try it. It's wonderful, especially if you're pregnant.